Well, what's all the ways that you would use a chiropractic? Does chiropractic adjustment help with nerve sensitivity? Yeah, through what? The gait theory. Can you use chiropractic adjustment for inflammation? What's the reasoning behind how you can use it? Now, when I say chiropractic adjustment, that could mean anything, right? I'm talking about a high velocity, low amplitude osseous adjustment, okay? So, how could chiropractic help with inflammation? What?
Vagus nerve.
Meaning what? He said vagus nerve. What does that mean?
Stimulating vagus nerve and reducing inflammation through that.
Okay. Some type of reflex? Okay. You're obviously more familiar with it than me. Okay. I'm not familiar with that reflex. Okay. One that's real obvious and easy. Does passive motion, if I have inflammation in my elbow, and I have external passive motion and I do this, will that decrease the inflammation in the elbow? Yeah, it acts as a mechanical pump. By the way, what else does it do when I do that for nerve sensitivity? Decreases nerve sensitivity. When I do this, what happens to the mechanoreceptors? They're firing, right? And what happens to the pain? Same thing that happens when you do this, when you hit your thumb with a hammer, right? It's called the gait theory. So anytime you mechanically move a joint, it will naturally do what with pain? It'll decrease it, and it'll naturally do what with inflammation? It'll decrease it, but for a different reason, because of now the mechanical compression extension effects of the movement. So for a different reason. By the way, do I talk like this in my medical reports, soap notes, and narratives? This is exactly how I talk. So I can use one therapy and explain it in like chiropractic, and explain it in all different ways in the inflammation phase, how I use it in the repair phase and the remodel phase. Same with muscle stem. Muscle stem I can use in all three phases because it's used totally differently in all three phases. And so I explain it differently. Okay, so what are you using for pain and inflammation?
Massage and adjustment.
Okay.
Same word washing, we can't use any.
Do you have any analgesics at all?
No.
No? Nothing at all?
Ice massage.
Ice.
Adjusting.
Ice and adjust. So the adjustment's the main thing?
Yeah, a little, maybe ice. It was a home ice.
Okay. What are you guys using for pain and inflammation?
Ultrasound, IFC, massage.
Okay, you can use ultrasound in the pulsed mode to help decrease. I don't like it because it's attended. It's manual and it's attended. But I mean, let's not get into efficiencies and all that. But yeah, you can use ultrasound in a pulsed mode for inflammation. What else?
IFC, massage.
Interferential current. Okay. Massage. What else?
Adjustments.
And adjustments. Okay, good.
Rapid release.
Okay. Okay, I can't comment on that. I don't know anything about rapid release. Okay. Pain and inflammation?
You stim, throw an ice pack the first few days on top of the stim.
Okay, so you use an ice pack with stim. Real common. And a chiropractic adjustment, right?
Yeah, adjustment and then traction, the other traction.
And then if traction if it's indicative with what? Compressive test. Right? Then there you go. Oh, that's good. So, what would be, so you see how all that fits that you said? So commonly I'm going to use anti-inflammatory therapies, I'm going to use analgesic therapy, and then I want to use possibly a muscle relaxer therapy. And if I have any spinal compression test, I can certainly start with any decompression type of therapy. And there you go. That's kind of classic chiropractic, isn't it?